He seems like someone who had it together, and that's why maybe it's so shocking for folks.
Yeah, it's really tragic. This is a man that's been talking about his mental illness since the 1970s.
He's been very public.
I know, and he's been a role model and an advocate for mental illness. He's talked about depression, he talked about bipolar, and about his struggles with addiction.
What does that tell you as a psychiatrist? Does that bring to light kind of the ugly truth that even if you're talking about it publicly, it doesn't mean that it's not right back there waiting for you?
You know, it's an insidious illness, all of it. It can be treated and managed, but just because on the surface he looked like he had it all together doesn't mean that he wasn't tortured on the inside.
And what is it? What kind of perspective can you offer? Because I think one of the, obviously, the most shocking thing about this is you have a man who brought so much joy and laughter to so many people, who seem to thrive on bringing happiness to people's lives. But how can you square that then with he battled this so privately, even though he talked about it publicly, and he lost the battle to those private demons?
I know. I think the fact that he on the outside had it all together doesn't mean anything, doesn't mean that he didn't struggle with depression. It sounds like one of the ways he coped with the depression was by being so gregarious and outgoing. And he was very honest about his sort of bipolar disorder, and when he was manic, I think he felt funnier and more driven, and he was sort of a role model for people who struggled with bipolar disorder and depression, that you could endure, you could be funny, you could be successful, but he struggled and he lost the battle.
Doctor, how does addiction and depression go hand in hand? Because when you look at kind of, we know well kind of his track record. He talked publicly about his cocaine and alcohol abuse. He quit that cold turkey after one of his very close friends, John Belushi, died. Right. Then you have then he fell off, then he fell back into drinking back in the early 2000s, and he talked very publicly about that. I remember in an interview with Diane Sawyer talking about that again. And then he was just in rehab this summer, I believe, once again dealing with his demons. How does addiction and depression, how does it go hand in hand?
So in medicine we talk about comorbidities, which means that two illnesses can co-occur. So it's very common for people with depression to struggle with substance abuse, and with people who have substance abuse to have depression as well. I mean, while he had a lot of success, he also had a lot of risk factors. He suffered from addiction, he suffered from depression and bipolar disorder. He was an older man, which are all risk factors for suicide.
And one of the things that is also surprising is he's been battling and very public about this for so many years. His family, his friends, especially his closest loved ones, they had to have been aware of the triggers, or if he was maybe going into that dark place again, you would hope. But does it show you that it doesn't matter how close your loved ones are, that it's something that you have to deal with on a very, very private, personal level?
You have to deal with it on a private, personal level, but I want to be clear that a lot of suicides are preventable. I don't know in this case whether this was preventable or not, but I think that what I think he would want the message to be is that while you have to suffer and work, it can be preventable, and that families that have loved ones that suffer from depression and suicide, they need to take it seriously, they need to ask questions, they need to be there, get help.
Even if he did look like one of those who had it together.
Yeah. Just having it together doesn't mean that on the inside he's not struggling. And if you have a loved one that's struggling with depression or has suicidal thoughts, you got to ask them about it. You got to remove firearms if you think that they're at risk for suicide. You've got to get them help. You have to take it seriously.